Health officials in Quebec are urging residents to exercise caution over the coming weeks in order to reduce the spread of COVID-19. They say the province is now in a seventh wave.
We're seeing that we're in a seventh wave because of the numbers that we're confronted to, which are much greater than they were before. I mean, less than a month ago, it was something completely different. And we're following the same path that we're observing in other countries, namely in Europe. So we're in the middle of it. Are we, I mean, in the middle of it, we're in it. Are we in the middle of it? That's a good question. So we expect it to curve. I mean, the evolution should curve down during the month of July, but there are uncertainties over that, and we will follow this situation very carefully.
Health officials are also urging people who get the virus to isolate, so stay home for 5 days, and then wear a mask in public for a further 5 days. And health officials in Ontario are also keeping a watchful eye on those rising numbers. CBC's Megan Fitzpatrick is on that story live from Toronto. Ontario's top doctor, Megan, says the peak is still to come. What is the situation right now?
Yeah, and he's saying that this new wave is being driven by this subvariant of the Omicron variant of the coronavirus. And this variant is called BA.5, and Dr. Moore is saying it's highly transmissible, and that we are seeing, too, people getting reinfected, Suhanna. So some people that had COVID maybe a few months ago and they were infected with that original Omicron are getting sick again, meaning BA.5 is able to sort of evade some of the immunity that previous infections should provide. And so that's all partly driving up the case numbers in Ontario as well. We are seeing hospitalizations go up in this province. Most of the public health units are reporting exponential growth in COVID-19. So it's a widespread wave throughout Ontario, not just localized. And yesterday, the Ontario Science Table said, you know, even a mild case of COVID-19 can be really disruptive to your life. You know, your work, your family life, maybe impacting some of those long-awaited summer vacations or trips or summer camps for kids. And Dr. Moore is saying that the BA.5 variant really started taking off in mid-June, becoming the dominant strain that's circulating in the province. And he says things are going to get worse before they get better, but they are expecting this to be a smaller wave compared to previous ones. Here's more of Dr. Kieran Moore.
Watched how it's affected England, the United States, Quebec, and so far I'm very pleased that it hasn't had a significant impact on our health system and that we're absolutely able to cope with current numbers. It will get a little worse over the coming week or 10 days and then decrease. That's our expectation, having followed these waves, now our third Omicron wave so far this year.
Now, he said that so far the healthcare system here in Ontario is coping with these increases, but Suhanna, the hospitals in the province, many of them are already under serious strain and stress. Many are short-staffed. We've been reporting on CBC quite a bit in the last few days and weeks about wait times in emergency rooms, record wait times. So really, they're hoping there isn't too significant of an increase in hospitalizations or people getting really sick from COVID that they need to go to an ER or to the hospital. Dr. Moore saying they are monitoring these statistics very closely.
And what is Moore advising people in Ontario to do? I mean, in light of this increase in cases, Megan?
Well, for sure, he's encouraging Ontarians to get vaccinated if they've never done that, or to get their booster shots, whatever they're eligible for. Here in Ontario, fourth doses, second booster doses have been offered to people aged 60 and older, as well as people with certain health conditions. But he was saying that many people who are eligible haven't gotten those second boosters. More than 1 million Ontarians who are eligible haven't rolled up their sleeves. He's encouraging them to do that. And he also said that the government is currently reviewing eligibility for fourth doses. So we'll be watching for any news on that front in the coming days. And meanwhile, he's encouraging people to wear masks indoors in crowded spaces if you are more vulnerable to COVID-19. And he's saying it's summer. Socialize outdoors where possible. That's always the preference compared to indoor get-togethers. And he said even outdoors, consider spacing yourself out a bit. You know, if there are people that you're gathering with who maybe are older or again have some health conditions that make them more vulnerable. So these are all pieces of advice we've heard before, Suhana, of course, but hearing them again now reiterated by Ontario's top doctor in light of him confirming we are in another wave of COVID-19.
We'll talk again. That is CBC's Megan Fitzpatrick in Toronto.